guys, welcome back to my channel. My name is Shila, and in my channel I talk about everything related to midwifery and everything related to midwifery really. And also I want to say a very big thank you to all my subscribers, my returning viewers. Thank you so much for sticking to my channel, even though I haven't really been posting so much recently. I am so sorry for that, and thank you for sticking to my channel. So today I want to talk about in the postnatal world as a midwife. Like, I'm currently in the postnatal world, and it's not like I'm just going to share the experience. I might liken it in postnatal ward, where I've been to antenatal ward delivery suites, and now I'm in postnatal ward. I haven't got to community, and yeah, I think community is where the whole thing started from. So in the UK, when you're pregnant, you have to do a self-referral to a community self-referral to a particular NHS hospital close by, and they will attach you. They'll give you a community midwife. So you have a midwife that you will be seeing. So every pregnant woman have their own midwife. So then is the midwife as well that will decide whether you're going to be solely cared for by a midwife, or you need a consultant inputs. Okay, sorry with the lighting, and I'm using a natural light, so sometimes it gets really bright and sometimes it gets down. I'm so sorry. It's because of there's a lot of sun right now, so I just said to make use of it. You can see the sun is shining on my face. A lot of that though. So, and just to let you know, if this is your first time of coming across to my channel, please do not forget to click on the subscribe button, and also there is a notification bell, so click on that as well, so you get notified as soon as I drop a new video. Okay, and also this is just to let you all know that those people preparing for their trying to look for a job, and you've decided that you want to do a self-sponsorship process. With a self-sponsorship, you will have to register for your NMC or ski yourself, pay for it, apply for a visitor's visa to come to the UK wherever you are. Then with that, you will need support with your OSCE preparation. So if that is you, I'm just letting you know that I provide OSCE support, so you can reach out to me for more information regarding my OSCE training. Anyway, that's that as well. So in the postnatal ward, as a midwife in the postnatal ward, so recently I do night shifts. Like, currently I do mostly night shifts, so I'm just going to talk about what happened in a 12-hour shift on the postnatal ward really. So in my trust, we start at 7 to 7:30. So the 7 o'clock you should be in the hospital already. 7 o'clock you should be in the hospital, and within 7 to 7:30 we are supposed to give an handover of care. So everyone will take handover. So after handing over, you're starting your day, so you're expected to you're expected to see your ladies. Okay, so this is generally about postnatal ward thing. Yeah, so when you go to see your ladies, so in my space as well, so you have at least 8 ladies, so one midwife to at least 8 ladies. So but sometimes your bay is not full yet, so you may be starting with fewer number, but you can have at least 8 ladies, 10 ladies, and sometimes 11, sometimes 10, sometimes 8, depending on how it is, right? I know some people in some other trusts who have lesser numbers, lesser numbers of ladies, but mostly is ratio 1:8, but some have more than that. Okay, you're expected to see your ladies and do a postnatal check for all of them. Okay, with the postnatal check, you're asking them, of course, you introduce yourself, you ask them how they are doing, how they are doing yourself. If they have done a C-section, you want to look at their C-section wound, and if they had a normal delivery as well and they have laceration, you want to ask them if they have any concerns with their laceration, if they want you to look at their lacerations as well. And also you want to look at You want to ask whether they've been able to open their bowel since they had their baby. If not, you ask if they've been constipated or not, or if they need any pain relief at that time, because pain is really significant. Like pain management is really significant in the postnatal ward. Okay, another thing is you also want to check your lady to see that which of these people need priority care, like which of these people need 4-hourly observations, more frequent observations, which of these people are on regular medication that you must not miss. Okay, medications like antibiotics, antihypertensive, you don't want to miss that as well. And who is these people that need that may be in so much pain, like first day C-sections, number 3 C-sections, or para 4, they may be in so much pain as well. So you want to be able to prioritize your work and see that which people you should attend to first, because you have 8 ladies, and if you plan to see the last lady, and that last lady is an hypertensive patient who needed to have antihypertensive at 8 o'clock, you might not get to, when you start around 7:30, 7:35, 7:40, you might not get to that lady until 8:30, and you don't want to miss that medication, so you want to do that first as well. So you need to prioritize your work. When you start after taking over, you look at those your ladies, which one exactly needs priority. Another thing is that normally they do discharge ladies in postnatal wards during the day, but sometimes they have a kind of rollover that ladies waiting to be discharged as well, which may be on your head that they really want to go. So it's a bit of in the postnatal ward, to be fair to me, the work is not really stressful, but the nature of it make it stressful. Okay, for instance, if a lady is waiting to be discharged, I have a lady waiting to be discharged, right? And I have another lady spiking temperature. I will need to go do that safety screen for that lady spiking temperature. And the lady waiting for discharge is on my neck to say, I need to go home. So now, what comes in here is your professional values and behavior. So then you need to be able to calm that patient down, try to explain to them that, oh, I'm so sorry, I'll be doing it, but I just have an emergency that I needed to deal with. Okay, I will start as soon as I can. Trust me. The moment you finish saying that, when you go in the next 5 minutes, they're out again. Their house again. So then you need to be professional. Sometimes the way you speak to them, they will say, oh, okay, that's fine. So then as soon as you can, you go start their discharge as well. But it's always cool when you don't have someone waiting to go home, so you can take your time to see all your ladies. So when you finish seeing them as well, so you ask them those questions. And another thing, you ask if they fed the baby, and you see people that need support with the breastfeeding as well. So you expect the baby to feed as soon as possible, really, and also every 2 to 3 hours. And those that is been breastfeeding, you want them to breastfeed on demand. Another thing, you need to be sure that this person that is breastfeeding, is she actually lactating? Because sometimes within 24 hours that milk is not coming out as much, and the woman keep breastfeeding, but that baby is not getting anything, and that baby is unsettled and crying. Mom is stressed as well. The mom blood pressure might go up because of all of that as well. So you really have to do a lot of things when as a postnatal midwife. Okay, another thing is the kind of care you provide for them as well also helps them reshaping their experience of all things about the process. Sometimes some people have had a stressful delivery, traumatic delivery. Now they're in postnatal ward and they meet with another midwife that is stressing their life out of them. Okay, so that then make the whole thing. But sometimes they've had a stressful delivery, traumatic delivery, and they got to the postnatal ward. They've been welcomed with a smiley face and a cheerful midwife, that all, and they have received so much support postnatally. Then that may actually change their whole perception about the whole maternity unit of your trust as well. So in essence, as a postnatal midwife, try as much as possible. I know it's not easy, but try as much as possible to be cheerful, welcoming, and supportive to the postnatal women as well. Another thing you do is, after seeing all of them, And how you do it depends, really. You can see one and go and write, but then you're going to spend so much time. Sometimes I just see them jot the point, their response, and then I will go write later as well. Okay. And yeah, if you're using a system in your choice, it's quite easy. Maybe in everywhere there is, what's it called in there, a system, so you can just type on it, and that's all. Okay. And sometimes you just click on it, it prompts you to the question yes or no, then it's that easy. But like in my space, that we still write. Yeah, see, I'm in the other version of Nigeria. no, like upgraded Nigeria Trust. So we still write, so then I will write. Then after seeing all of them, and you're expected to, they should have done in 1600 medication, right? But sometimes they don't. Then you do 10 o'clock medication, so you give all of them pain relief, especially except if they are not due or if it's going to be too close, but you serve all of them pain relief even if they are not in pain at that time, because they will definitely still have pain later. Okay, so you offer them, of course, if they say they don't want it, okay, but you offer all of them pain relief at 10 o'clock. Then you will also give due antibiotics and all of that as well. Sometimes you have antibiotics for those that are having postnatal sepsis. You have to give them antibiotics and all of that as well. Regards to observations, sometimes you have support people that do the observations for you as well. Then after then you're expected to be answering buzzers. Yes, answering buzzers for support, for breastfeeding support. You're expected to see them as well. You've seen all of them by 10 o'clock. Then maybe before you get through to all of them, it's like 11 o'clock. So around 2 o'clock, you expect to see them again, to see that whether they are fed baby, since though when you see them at 10 o'clock, you ask them again if they're fed baby. By around that 2 o'clock, 2 to 3, you're expected to see all of them again to see whether they are fed their baby, because they are meant to feed baby every 2 to 3 hours as well. But there are some baby that are tricks of, some mom are not just, they are slept off, they forget to, to feed the baby, so you are expected to go. If you go around 3 o'clock, if some of them are sleeping, you might just leave them, not waking them up. But at around 5, 6 as well, you're supposed, if you see them at 3 o'clock, then it's around 6, because it's 2 to 3 hours you're expected to feed. Around 6 as well. So someone that is sleeping around 3 when you went to check them, you might want to check them as 5 as well, because then it's going to be longer if the baby has not been fed. So around 3 o'clock, you want to go there as well to check them again. Okay, to see around 5 o'clock, you want to check in again if they're fed. Then also you want to check all the ladies, the one that need a postnatal FBC to be done, those people with low HB antenatally, and those people who have had more than 500 1000 EBL. Another thing is, you want to check with your hospital policy. What does it say? Is it like 6-hour FBC, 12 hours FBC, and all of that? So those ladies that needed FBC, so you need to take their bloods. Yeah. And so during your shift in the night, if you have a concern with any of those ladies, you need to believe the doctors to come and review them. Okay, so most cases in postnatal ward, the general medical doctors, the SHO do their reviews as well. But if you have anything of obstetric concerns, obstetrically and anything of obstetric concern, then you need to call the obstetric register. Things like excessive bleeding and yeah, something like that, maternal collapse. Yeah, I've had like near maternal collapse before in postnatal ward, because sometimes you want when they stand up for the first time to the toilet, then sometimes they feel weak and all of that, so it's possible as well. Another thing, as a postnatal ward midwife, you want to know about the truck policy. So that's trying without catheter policy. When exactly are you supposed to remove that catheter, and when you remove the catheter, how long does it take them to does it say for them to remove to pass urine? So this may differ from trust to trust as well. Sometimes if they have a C-section, the catheter should be removed maximum of 12 hours, except otherwise stated by the consultant that did this, or the surgeon. Sometimes they find out about some things during the surgery and they want the catheter to stay longer. Okay, but if it is not stated, you just have to go with your policy. So you're expected to read about your hospital policy to know what is expected, how long should that catheter stay in, because then if you stay longer, it just increase of the risk of postnatal sepsis. And normally postnatal ladies are at risk of sepsis already, especially with the one with C-section. So you want to really remove the catheter based on your policy. Another is the reason the catheter was in there in the first place. Sometimes catheter is in there just for epidural. It's not like the patient had a section, okay, just because they are on epidural. Some is because of forced delivery. Some is because they have a trauma, an instrumental delivery. So how long that catheter needs to stay, they might change. So you need to be aware of all these things for you to, like, work safely in the postnatal ward. To be fair, postnatal ward is not that significantly stressful when it comes to, like, professional, like clinically wise, but it's more stressful because you have to deal with more people. So now literally, if I have 10 ladies and they all have babies, so literally it's like I have 20 people that I'm taking care of. So that's how it looks like. So with a baby, you have to provide breastfeeding support. So if I have to provide breastfeeding support for all of them, it's not all of them, because sometimes you have people that is powerful, maybe lash on the breast, sharp. But sometimes you have first-time mothers that is like 10 people that you have to support breastfeed. And sometimes you just have a baby that is reluctant to feed. No matter what you do, baby just put mother there, and baby needs to eat. And sometimes you have babies that needed extra care. You have baby on IV antibiotics. And sometimes you have somebody that is just straightforward, just awaiting discharge in the morning, just awaiting NIP and to go home in the morning. So it depends. And sometimes, I think my last shift, I didn't see that until like 5 o'clock. There's always one thing or the other. Anyway, have you worked in postnatal ward before? What was your experience? How did you find it in postnatal ward? Do you want me to tell you about my role as a midwife in charge of postnatal ward? So if you're a midwife, like a band 6 midwife can charge the ward. So if you want me to talk about my experience, as a postnatal ward in charge midwife, please say that in my comment section, and I will find time to share the fantastic experience as well to you. And I will see you in my next video. So thank you so much for watching. Do not forget to share with your friends and colleagues who might benefit from this information. And if you're just newly transferred to a postnatal ward, you're currently struggling, don't worry. This is just all what you need to do in the night shift. Just it will take time for you to master it. Just try as much as possible to prioritize your work and plan what you need to do. Know about your hospital policy. It's very, very important, because that's what guides you. Sometimes you need to know about the medications they use, because sometimes they use different antibiotics antenatally and postnatally. So you might need to tell the doctors when they are prescribing it, because some doctors just join your trust and they don't know about this policy. So you need to let them know to be sure the patient is getting the right care. You need to check up on babies as well. Sometimes we have nurses that do the most care of the baby. So again, depends on your trust policy. And yes, it's important to work together, to ask questions and support each other. Then the shifts will be nice. I'll see you in my next video. Bye.